In this section, EDI in the dental office, we will discuss how EDI works within a dental office. Where does EDI start at a dental office? It starts at the time the patient calls to make an appointment. The office will ask the patient if they have insurance. If they do, they will gather information to verify the patient is covered by the insurance. Typically, this will be things like patient name, birth date, insurance ID, and group number. Sometime prior to the appointment that was scheduled during the initial call from the patient, the office will need to verify coverage. Depending on the office's practice management system and the insurance carrier, this can often be done while the patient is on the phone making the appointment. There are various ways to verify coverage. Some are more efficient than others, but the most efficient way is to use an EDI transaction. The most common ways to verify coverage with payers are to make a phone call, use the company website, or send an electronic request to the payer. The electronic request is the most efficient. In some practice management systems, this can be done during the time the appointment is being scheduled. In other cases, dental office staff may need to use a third-party service. Such services send electronic requests for the dental offices. The electronic request for eligibility and benefit information is a transaction known as a 270 transaction. When a 270 EDI transaction is sent to the payer, the company responds by checking eligibility electronically and sends back the eligibility and benefit information. This response from the payer to the dental office is called a 271 transaction. The benefit information is important to the office because this information will be used to determine what the office can charge the patient. With this information retrieved, the office is ready for the patient appointment. Many dental offices use a software package called a practice management system. During each patient visit, the procedures that were completed are charged out in the practice management system. Based upon the benefit information, if there is anything expected from the payer, this now needs to be billed. As we see here, yesterday's dental offices used the U.S. mail for all sorts of communication with the payers. Today, modern practices use EDI transactions instead. In the old days of dentistry, this required filling out a paper form, attaching x-rays and other things to the paper form, and then mailing this to the carrier, often in a large envelope. Today, an office can send all this information electronically via an EDI transaction. The transaction used to submit a claim is known as an 837D transaction. The D is for dental. There are various methods to get the attachments that need to go with the claim to the payer. Check with your practice management vendor for the method they use. Notice here that there is a lot of patient information collected and transmitted, whether by paper or through EDI. All EDI transactions are certified as secure and safe by the Health Information Portability and Accountability Act. All violations of the HIPAA are subject to severe legal penalties. Once the claim is sent via the 837D transaction, now the office waits for payment. Many use their practice management systems to run tracking reports to make sure the claims are paid in a timely fashion. In the old days, dental offices would have to wait 30 to 45 days to get a piece of mail that would explain what the payer was going to pay, what was denied, and what might have been downgraded. Today, dental offices that use practice management systems for payers that support it can request information about their claims electronically. This is known as a 276 transaction, and it's a claim status inquiry. The payers that have implemented this EDI technology respond by sending an EDI 277 transaction a claim status response within a day or two that explains the current status of the claim. They may also send follow-up 277 transactions that indicate the claim has been paid or denied. Now we have reached the point where the claim has been paid. In the old days of dentistry, offices would receive paper checks in the mail attached with EOBs, otherwise known as explanation of benefits. Today, more and more carriers are offering ERA, also known as electronic remittance advice. The ERA is an electronic version of the EOB. If the practice management system supports it, these electronic EOBs can be posted automatically, eliminating the need for an employee to do this. This electronic EOB is known as an 835 transaction. So, from the first point of contact with the patient all the way to the point of payment, EDI transactions can be used by the dental office to accomplish the task at hand. So now let me summarize what we have discussed in this section regarding EDI transactions. 271/270 transactions can be used to request and return benefit information. The 837D transactions are used to submit a claim to the payer. The 276/277 transactions are used to request/provide information regarding the current status of a claim. 835 transactions are an electronic version of an EOB that also delivers payment information.